This is the Visible Voices podcast. I'm your host, Dr. Resa E. Lewis. In today's episode, I'm delighted to be speaking with Dr. Thomas Fisher. Thomas is a board-certified emergency medicine physician. He served as a White House Fellow in the Obama administration, as a Robert Wood Johnson Foundation clinical scholar, and he holds a master's in public health. Tom works in the emergency department at the University of Chicago Medical Center, caring for the same South Side community in which he was raised. He's the author of The Emergency, A Year of Healing and Heartbreak in a Chicago ER. This book was named one of Time Magazine's 100 must-read books of 2022. Tom is now running for Congress in Illinois' 7th Congressional District. Welcome to the Visible Voices podcast, Dr. Thomas Fisher.
It is wonderful to be here. Resa, thank you for inviting me and for being patient with the coordination. It's good to chat.
Yeah. Let's start in on the book. It's 2025. You wrote this. It came out in 2022. How are you different having written this book?
So I actually wrote the book during the pandemic. And if you remember, we would work all day or all night, depending on what shift you had. And then you came home and there was nothing to do. There were no restaurants. You could not travel. There was nothing on TV. We were spinning up opportunities to do sort of like these group game nights. I don't know if you did things like that, or group cocktails on Zoom where you could catch up with people. But I needed a place to sort of vent. Look, I had a therapist, right? It helped me keep sane. I know we saw a lot of death that year. We saw a lot of suffering. It was the first time we were in the equation where normally we finish our shifts, no matter how bad it gets, we go home and we're fine. But this was one of the few times where you could go home and take it with you. Literally getting sick or getting your family sick. And so this was a catharsis. Like every day I would jot notes. Every other day I would write pages. I wrote every day during the pandemic. The pandemic changed us all in ways that are difficult to fully quantify. But one of the ways that the book specifically reshaped me was it forced me to be really, really honest with myself. Why am I doing this? Not writing. Why have I made the career choices that I've made? What am I actually frustrated about? When I'm mad, I often want to be like, well, if this hospital administrator just did their job, or if only these pharmaceutical leaders would do whatever. But what is the bigger question that's at hand? And if I know that I'm going to write it down and it's going to live well beyond me, I won't be able to defend it. What I actually meant when I said that was X, Y, Z. No. It's on paper. What do I really mean? It was a very important crystallizing event around my own beliefs, who I believe myself to be, why I'm angry, what I want out of this professional journey that I have, and how much am I willing to do for it in the context that we only get this one life.
Yeah. So this chapter, you are running for Congress in Illinois' 7th District. Not everybody's from Chicago. Not everybody likes the Bears, but perhaps they watch the TV show The Bear. Tell us about your district and what motivated you to run.
The district is large swaths of the south and west side of Chicago, all of downtown and some of the western suburbs. It is entirely contained within the county of Cook. It was held by Danny Davis, who announced his retirement in July, who's held the seat since 1996, I think. It'll be 30 years when he steps away, and he leaves big shoes to fill. It is one of the most democratic districts in the nation, plus 34. It's the most democratic district in the state of Illinois. It is traditionally a Black West Side seat that has been in evolution because of much of the growth of downtown, West Loop, South Loop, some of the more affluent downtown areas, which are much less Black. And so it is now plurality Black still. And it can be a very interesting seat to talk. And in a healthcare election, with so many people losing health insurance, it's an opportunity and a platform to take some of these lessons around what we owe to one another when we're most vulnerable and translate that into the kind of policies that keep us from being preyed upon when we're most in need of help. and even go upstream and ensure that we have the sorts of affordable resources that keep us from getting sick in the first place.
If people were to guess your platform, they'd say, or give me is healthcare. What else are you running on? What are you standing up for?
I think that the core is moral leadership. We were talking a little bit beforehand about how Democrats often run like they're writing a grant application and have the sort of policy details that may be correct, but people glaze over and won't be able to do them in a democracy that's messy in a negotiation. But at the core of that is what is the point of the state? Right now, we have a state that is taking away health insurance and SNAP benefits. If the state cannot provide food and medicine, what is the point? That's moral leadership. These are budgets and choices. The upstream inputs that lead people to me sick and injured are things like housing, food stability, the ability to pay your rent, transportation to and from work, the things that allow for you to invest in your body, in your lives. One of the biggest changes we've seen are some of the jobs that people used to provide them health insurance, used to give them the sort of work day that they could then invest in, cooking and taking care of their families, going for long walks. Many of those jobs have turned into 2-gig jobs, which means people are working longer for the same or less money, then have to rely on things like the Affordable Care Act exchange and the subsidies that come with it that are being cut, Medicaid, which is being cut, other SNAP benefits, which are being cut. Well, it becomes no coincidence that those folks have shorter, more painful lives because we haven't invested in them. And then we blame them, right? I think the upside of some of our experience in the emergency department is we are used to making high stakes decisions with incomplete information. Like, that's what we do.
That's emergency medicine. Yeah.
We don't know. We never have all of the information by the time we have to make a real decision. And then we do it again, right? We iterate and we do it again, and then things go right or wrong and we keep changing it. And then we go back and see the next patient. So there's a part of this that is extremely high stakes. Like, our Congress is in the balance. The future and accountability of things like ICE in our streets is in the balance. I mean, I know you're not in Chicago, but in Chicago, ICE is an ever-present danger and one of the most talked about issues. I think that it's being captured in the media, but the impact is even bigger than what you can see on television. Like, it's beyond sort of like these big kerfuffles or the big, where people get rounded up and, it's on TV. It's having folks sitting on the corner waiting, right? It's one of my friends in Oak Park whose Girl Scout group was collecting food for a food pantry and they couldn't go down a street because there was ICE activity. Like, what is the state? Like, what is moral leadership in these settings? How do we protect one another when we're vulnerable? I mean, obviously part of that is healthcare, but part of that is affordability. Part of that is getting guns off the street. Part of that is making housing choices. Part of that is getting into a Congress that allows for us to have the kind of hearings that ensure these things now.
Civic health and our engagement as physicians in an increasingly politicized healthcare system and in civic health. Off the mic, I shared that I have a very broad definition of health. It's not just a Resa thing. Many of us do. Financial health, you just described community and social health, physical health, mental health, civic health. And I'm newer to this civic health and the importance of it. And I'm 100% on board with its importance and physicians engaging in the political system. Why do you think it is important for physicians to actively engage? And how did that call to civic health push you into the candidacy?
Yeah. There are six Democratic doctors in Congress, handful of nurses, overall, a few more doctors, who are making decisions about some of the most important resources in our society, 18% of GDP. Doctors know what the stakes are. Not just doctors. There are other people in society who are a part of these important decisions, but doctors know the stakes. And I think that in general, what we need are more people who see this as public service, who are being called to serve, to bring their specific skill set, their experiences, their community with them, to try to reshape a component of our society towards good. And I think that in this moment, healthcare is central. Like, we just had a prolonged government shutdown over healthcare. Now, I'm not happy with the way it turned out. I don't think that we ultimately got any of the healthcare needs that we desired. And that's going to mean many tens of thousands of people in Chicago alone, 60,000 people are going to lose their health care over this. And that's going to penalize and likely close clinics and hospitals as well. But who would make a better argument for that than people who are on the front lines of this? I think we need more teachers going into public service. I think we need people who are on the everyday end of these issues need to step up, raise their hand, and move forward. And I think that doctors in particular have a level of trust, a level of clarity, understand many of the ways we use data to make decisions. And so if you see this as a group, as a team, there's a doctor role on that team that makes the team better. And I think that we kind of have comfortable lives in ways that sometimes keep us on the sideline. Certainly this is way harder. Running for office is way harder than what my life was before, right? But is my life really about just being comfortable? It's not. There are missions that are worth being uncomfortable about. And I also think that doctors have been taught to be risk averse.
Say more.
Think about the amount of data we want before we make a decision. How often we have redundant safety procedures when we do a procedure, when we're doing a procedural sedation or another procedure, we have a lot of redundancy around risk mitigation, which is good. Lives are on the line, right? We need that. I am not arguing that we should get out of that practice. What I'm arguing is that doesn't have to apply to everything we do, right? Some of the risk mitigation is okay, you've got this very long journey, educational journey before you get to a point where you're doing the work. And so you just sort of patiently delay gratification and you just follow the journey. You don't take risks along the path. You just kind of step forward. And I think that some of life requires a leap. It's naive. There's a component of naivete that is this risk taking that jumped into this campaign. If I knew everything that it was going to take to win, and I'm not at the election, I don't even know what it's going to take at the end, but I'm 15 weeks in. To get from the beginning to here, I had to learn along the way. People had to come to my support along the journey. You can't have all of that planned at the beginning. You have to say, well, this is the goal that I want. I have the capacity to learn. I have the support that I need to get started, and then get to chopping wood.
Yeah. You mentioned losing sleep. You mentioned a calling. And I think, along the steps of life and professional responsibility, some of us receive these types of callings or these awakenings in the middle of the night that are aha moments. And, I talk here on the Visible Voices podcast about voice. And I'd like to ask you about your voice right now. When did you realize you had your voice? When did you start using your voice?
Ooh, that's a really good question. I think I got an inkling of it when I was an RWJ clinical scholar. I think that was the first time where I had more opportunities to speak publicly. And I gave a presentation at the national conference about implicit racism in the clinical setting, which at the time was very early on in the understanding. I had a colleague at the business school who sort of had this IAT test, and we're talking 2004.
What's IAT?
The implicit aptitude or implicit discrimination aptitude test. It was something like that, where you were flashed in videos and you had to make a snap judgment about them, and it helped to reveal some of your subconscious leanings. And I was applying that to patients in the emergency department and doctors' implicit perspectives on that. And long story short, I presented some of this work at a national conference, and I just stood in this perspective that, these are good people who might still make bad decisions, right? Not because of anything wrong with them in particular, but because of our training, our overall, media consumption, things of that nature. And I got a kind of reception that I was like, oh, there's more here, right? It's not just the topic, it's the way we talk about these topics, the way I can talk about these topics. Then I don't think I got a little bit more of it and learned more about how to use a platform when I was a White House fellow. But then there's a period in my career, maybe everybody's career, where you're sort of a cog in a lot of wheels. You're not actually fully able to speak your own truths and your own perspectives. And I think I stepped out of that when I wrote the book. That's when I was like, no, this is an opportunity for me to sort of describe my own journey. And part of and do that mostly for myself. I didn't expect the book to be as successful as it's been. I thought I might get emergency medicine famous, like, other ER docs would see themselves and be like, man, that was great. But but it got bigger than me relatively quickly, and it gave me the opportunity to speak to audiences that were not healthcare. And when you are speaking authentically about a version of the truth that you know intimately and don't hedge about it, people hear you.
Right. That's right. For people that want to continue to hear you, follow along, support your campaign, what's the best way to keep in touch?
ThomasFisherForCongress.com is our website. There's an opportunity to sign up there. We've got videos and media and all kinds of updates that will continue to flourish. That's probably the best way. Grab my book. I mean, there's no, people are constantly in evolution. You will know me from 2020, right? I am unflinching in my accounts of what happens in the emergency department and personally revealing about the fact that there are no heroes in this, including me. And I think that those are probably the two best ways to engage. And I would also say that most folks listening to this won't be able to vote for me. I mean, certainly you can contribute, and that is one of the most important components of a campaign. But there are going to be people locally that you need to get involved in. I worry so much more about apathy than anything else, where folks sit back and just feel as though there's nothing that can be done in these moments of great crisis, or have this other sort of apathetic perspective, like, it doesn't matter what I do. The arc of history bends towards justice. It's going to be fine. It's like it bends towards justice because people fight. They stand up in these moments and fight. And if you're not going to be one of the people who fight, like, it's almost worse to be a bystander than not fighting on one side or another. And I worry about the bystanders who are just like, oh, look at that, it's amazing. Like, get involved. And I think I am a descendant of people who are held in bondage in this country. There's stories in my family of uncles who have been lynched, of being prepared to flee, things of that nature. Like, this country has a history. Throughout, we've persisted, right? And demanded, not that America does something unique and different, but just does what it says it is. Like, just guarantee rights, just provide, just, people are created equally, do that, right? But those things require that you're willing to persist, even when you're in a stress position. My grandparents didn't have the opportunity to just say, well, this kind of sucks, but I'm just going to keep being a doctor and it'll all blow over. No, they were in a stress position, but they had to persist. You can't give up. And I think that our ability to transcend moments like this requires that people endure stress positions long enough to get to the win, right? To get to the part where we are not fighting over individual rights anymore, right? And what that means is it's generational work. We're not, my ancestors who were held in bondage didn't know that we would get to this point, but they had to push for it, right? And I worry that we're like, well, this didn't work in this election, so I'm going to give up. Like, 50 years of work. Like, we each get 50 years of work. Use yours. Let's go.
Yeah. Tom, what should the title of our episode be?
Normally I say things like, policy is a love letter to one another, or something like that. And I actually think we need something more active in these moments, which is like something like, it's our turn, right? I don't know if we're of the same vintage. We might be close or something like that. But like, there's a component of this, which is there's generational change, and it is our turn to make a mark in society. We've learned enough. We have enough people who want us to succeed and are willing to support us. And so it's our turn. What are we going to do with that?
Dr. Thomas Fisher, thank you for joining me on the Visible Voices podcast.
Great to be here. Thanks for the conversation.
The Visible Voices podcast amplifies voices in the healthcare, equity, and current trend spaces. Our team includes Dr. Giuliano DePortu and me, Dr. Resa E. Lewis. Find me at Resa E. Lewis, MD on social media, or visit thevisiblevoicespodcast.com. Find us wherever you listen to podcasts and watch our episodes on YouTube. This podcast is for education and entertainment purposes only. The views and opinions expressed by our hosts and guests are their own and do not reflect the opinions of their institutions. Information shared here should never substitute for clinical judgment or for medical advice. Together, we're making healthcare more equitable, one visible voice at a time.